International data suggests that Black women are 41% more likely to die of breast cancer. So we have to do the early detections because it's extremely vital for survival.
That data published by the American Cancer Society, who earlier this year released a report on cancer and the disparities experienced by Black women. Doctors here in Canada say early detection and cancer screening save lives, but there are health gaps that also exist in our country.
I asked my doctor if I should start having mammograms now that I'm 40, and her response was no. And then again at my checkup at 42, I said, should I start having mammograms? And again, I was denied by my doctor because I wasn't 50 yet.
2 years later in 2017, Dawn Barker Pierre discovers a lump on her chest. Then came the diagnosis, triple negative breast cancer. Since her surgery, the then 44-year-old has been cancer-free. But Dawn experienced something she doesn't want anyone else to go through.
I didn't feel like I was given the correct advice to not have mammograms when I asked for it. I made an effort on my own to be proactive, but I find that the healthcare system is unfortunately designed to be reactive.
Women's College Hospital says there are certain populations who are under-screened for breast cancer.
Women who are racialized, who are living with low income, perhaps who are immigrants, who are from certain religions, people who are trans, are less likely to access breast screening.
It's these communities that the hospital wants to reach out to and address the health barriers they face. Education and access are key, so are healthcare providers.
Is your primary care provider talking to you about screening? Are they educating you about what screening means and offering you the test? Are they looking at your family history to see when you should be starting screening? Many people don't know what screening means.
The Olive Branch of Hope and Women's College Hospital launched Every Breast Counts, a space dedicated for Black women, with tailored information from prevention to screening to diagnosis and treatment. Dawn has been instrumental, also encouraging early cancer screenings for Black women.
There's a lot of gaps that need to be closed, and there's a lot of listening that needs to be done by the healthcare professionals.
Women's College Hospital is also fundraising to bring in 8 new ultrasound and mammogram machines, saying they'll be able to see 1,000 more patients annually.
I hope they will increase access to this important screening that people need.
Dr. Lofters also adds that there's been an access piece that came up recently, and that is that screenings were put on pause during the pandemic. She says healthcare providers are now hoping to catch up on that list and also increase access to screening. In Toronto, I'm Faiza Amin for City News.